IR-based hemoglobin measurement using non-invasive technique and its classification. Abstract hemoglobin is the protein molecule in red blood cells that carries oxygen from the lungs to the body's tissues and returns carbon dioxide from the tissues back to the lungs. Hemoglobin consists of 4 protein molecules, globulin chains, that are linked together. The normal adult hemoglobin, HbG, molecule contains 2 alpha-globulin chains and 2 beta-globulin chains. Invasive method comprises of physical examination and credentialises the color of a drop of blood on filter paper to a standardized color comparison chart 3. Here is an attempt to design a system for non-invasive hemoglobin monitoring and classification. A non-invasive hemoglobin monitoring using infrared is showcased. It includes near-infrared radiation on an index finger of your hand and sensing the resultant radiation after absorbance by hemoglobin. The hemoglobin count is measured across to the voltage level through a chain of observations and results are obtained. The results are further used for analyzing the various hemoglobin-related diseases prevalent in women. 3. Keywords: non-invasive, monitoring, fuzzy logic, classification. Introduction. According to World Health Organization, the normal range for HB is for men 13.5 g/dl to 17.5 g/dl and for women 12.0 g/dl to 15.5 g/dl. HB values can be lower or higher than the normal range, resulting in different types of diseases. If HB concentration is lower than normal levels, then it is termed as anemia, whereas high HB levels is termed as polycythemia. 2 manuscripts. A. Hemoglobin. Hemoglobin is present in the red blood cells of the body. Absorption of light by oxygenated and deoxygenated hemoglobin is measured by wavelengths 940 nm and 660 nm respectively. Each red blood cell, RBC, contains approximately 280 million hemoglobin molecules. The main task of hemoglobin is to carry oxygen from the lungs to the tissues and then transport CO2 from the different tissues to the lungs. One hemoglobin molecule has the ability to carry up to 4 oxygen molecules. There are 2 main components of hemoglobin: oxyhemoglobin, which is saturated with oxygen molecules, and deoxyhemoglobin, also is called reduced hemoglobin, which is desaturated with oxygen molecules. Oxyhemoglobin is highly associated for oxygen than deoxyhemoglobin, and deoxyhemoglobin is highly associated to CO2 than oxyhemoglobin. Therefore, oxygen combines to oxyhemoglobin in the lungs and is then transferred through the bloodstream until it reaches various tissues. There, the oxygen is released to myoglobin, which then carries it to the mitochondria, and thus used for aerobic respiration. In exchange, deoxyhemoglobin picks up 2 protons and 2 molecules of CO2 and returns to the lungs, where the CO2 is set out through exhalation. B. Advantages of non-invasive techniques. Needle-free, painless testing system. Eliminates possible infections. Advantageous to the hemophobic and diabetic patients. No need of expertise. Device is portable. Cost-effective. Real-time monitoring system. See description of block diagram. The block diagram is shown below for the detection. Figure 1, block diagram. D. Hardware analysis. Figure 3, entries of different age group. E. Result discussion. For women category having hemoglobin level between 12–15.5 grams per deciliter is considered normal. Values below 12 to 13 grams per deciliter is considered to be iron deficit anemia in females. Similarly, the hemoglobin level can also be used to detect the hemoglobin-related diseases during pregnancy. The value below 12 grams per deciliter will be considered iron deficit and will have voltage range between 6.8 mV 7.0 mV, and below 10 grams per deciliter is anemic with voltage range between 7 mV 8 mV. The hemoglobin level intensity can also help in finding the heart rate of a patient. 3. Conclusion. A general conclusion. As the hemoglobin increases, output voltage value reduces and thus inversely proportional. Higher the hemoglobin count, higher will be the rate of the IR absorption, lower will be the output of photodetector and hence less output voltage. Interference of light with the samples could cause error in readings. B. Future scope. By using fuzzy logic, the device could be enhanced to describe the medications for anemic and polycythemic subjects. Same principle could also be used for monitoring cholesterol and glucose level 3 and also to find the heart rate of a patient.